Well, a warm welcome to this talk. Now, are we missing out on cures for cancer is an interesting question. And today we're going to be looking at this paper here, Fenbendazol as an anti-cancer agent, a case series of self-administration in 3 patients. And we'll be addressing the small number of patients later on in this video. And as always, I've got all of the notes here and the links that we're going to be using. So the thing is, fenbendazole, it's actually a veterinary preparation in the UK. As far as I know, it's not licensed for humans, but it's very similar to mebendazole. But this is about fenbendazole. Now, of course, this is not medical advice in any way, shape or form. Never stop or start any treatment based on what we say in these videos. This is entirely for educational interest purposes only. So fenbendazole, it's an inexpensive, widely used accessible antiparasitic drug used in veterinary medicine, dog dewormer if you like, and it's readily available. And the patent on fenbendazole expired in the early 1990s. Now, I think you know what this means. It means that anyone can make it, therefore it's hard for any manufacturer to make a lot of money out of it. So it's now a generic drug, so people can make it, Indian pharmaceutical companies can make it by the ton if they want to, and of good quality as well. So let's look at case 1 in detail, and then I'll just mention the other couple of cases, more not quite in passing, but with a little less detail, otherwise we'll be here forever. And if things go well, I'm going to give a fascinating story from the history of medicine as well, but you have to hang on for that. So case 1, 83-year-old woman, October 2021, stage 4 breast cancer, and I've listed all this here. I'll put this all in the notes so you can follow the story for yourself in the description. So stage 4 breast cancer, in other words, it spread around the body, metastatic disease. She'd initially been diagnosed with breast cancer in 2009, but she'd been treated. She'd had a bilateral mastectomy in 2009 and other treatments, and she did well for a while, but then the disease recurred in 2021. A liver biopsy confirmed metastatic breast malignancy. In other words, it had spread to a liver. Now, we say if it spread to your liver or your bones, basically that's basically a death sentence, normally. So this had spread to a liver, confirmed metastases, acidic fluid. So ascites is the swelling in the abdomen you get as a result of cancer and other things. But that confirmed metastatic breast cancer when you take the fluid from the abdomen through a tap in the wall of the abdomen, you send it for cytology and they could see malignant cells. Now, magnetic resonance imaging, MRI, of the spine, October 21, metastatic breast cancer in T12, that's thoracic 12, thoracic 10 vertebrae, lumbar 1, lumbar 2, lumbar 3, number 4, number 5, sacral 1, sacral 2, and the iliac bones. In other words, this had spread to her liver and her bones. Clearly an intractable terminal diagnosis by all criteria. It was all over the place, basically. A PET scan. Now, a PET scan indicates metabolic activity, given a radioactive isotope, and it detects metabolic activity. And of course, cancer is very metabolically active, so that would light up. So a PET scan on the 29th of December 2021 showed 6 hypermetabolic lung lesions, and the largest was 2.8 by 1.5 centimetres. In other words, it was in her lungs. So it was in her spine, in her lungs, in her liver. This was everywhere. Hypermetabolic bone lesions, the biggest was 5 by 2.9 centimetres. And a lytic lesion, that just means basically see a hole in L4 extended to the spinal canal area. The patient declined further conventional chemotherapy or radiation therapy and was placed under hospice care. So basically end of life care. Now, you might need to look at the notes to follow this accurately, but I've got it all here. November 22nd, 2021, she started self-administering fenbendazole at a daily dose of 222 milligrams. So she just basically started giving herself Fenben. In December 2021, she received another injection to block estrogen intended to inhibit cancer growth. So you got a bit of a complication there. You got two treatments going on at once, but to give an estrogen blocker at this stage would not, under normal circumstances, be curative. Anyway, moving on to 2022 in January, she did have targeted radiation for 2 spinal metastases. The spinal metastases are horrible. Things press on the spinal cord and on the main nerves. The pain can be indescribably bad. Nerve pain is you really don't want nerve pain. So she had radiotherapy for that, but that would only affect where the radiation targeted. It wouldn't affect the liver, it wouldn't affect the lungs, it wouldn't affect the other vertebrae. These tumours disappeared rapidly, relieving the pain within a few days. So very effective palliative treatment, but not curative because it wouldn't affect the cancer in other parts of the body. Continued taking 222 milligrams of fenbendazole a day for 8 months. During this time, her liver enzymes normalised. So the cancer was in her liver. That would alter her liver enzymes, but they went back down to liver enzymes went back to normal. Now, something called CA2729 is a tumour marker. That dropped from 316 in November 2021, and then in July 2022, so 7 months later, it was down to 36.6, indicating there was massively less tumour in her body. Then April 2022, a PET scan, again looking at the metabolic activity, confirmed the absence of any abnormal metabolic activity indicative of cancer. Quite staggering. So it wasn't her lungs, it wasn't her vertebrae, it wasn't her pelvis, it was in her liver, and yet after 8 months of fenbendazole, the PET scan confirmed the absence of any abnormal metabolic activity indicative of cancer. It's not saying that's the cause, of course. We'll come on to that in a minute. Now, patient was confirmed to have no evidence of active disease. This is in June 2022. All treatments were discontinued and she was considered to be in complete remission. Nothing I've ever seen. And I'm sure even oncologists watching will very, very rarely have seen such a dramatic turnaround. Follow-up monitoring was scheduled for every 3 to 6 months. Throughout her fenbendazole treatment, she continued her regular supplementation of vitamin D 5,000 international units and a multivitamin, and I would imagine that vitamin D was important because it's an immunomodulator. It's necessary for normal immune function. Subsequent PET scans looking at metabolic activity showed no abnormal metabolic activity. The fenbendazole treatment period revealed no adverse effects at this dosage, so no adverse effects from the fenbendazole. The patient the patient remains recurrence-free and continues to take fenbendazole nearly 3 years after being declared in remission. I am delighted for this lady. It saved her a very painful death so far, and God willing, she'll continue to do well. Now, so that was that paper there. Do check it out for yourself. I might show you a bit more from it in a minute. Now, the other thing that I found when I was looking here is what's called the Joe Tippins protocol. And again, this is not me giving advice. I'm merely pointing out that this exists. Here it is here. Fenbendazole.org. Fenbendazole, 222 milligrams, according to this protocol. Now, this protocol is saying take 1 capsule 3 days a week. I know you won't be able to see that, but I'll put the link. Look at it for yourself. And then take no mebendazole for 4 days. Is this Joe Tippins protocol? It's also advising some other things, CBD oil and curcumin. Again, this is not me prescribing. I'm simply saying what this says. And fenbendazole should be taken with food, preferably fatty food, I would have thought. So that's the famous Joe Tippins protocol there, or the original protocol from the Joe Tippins site. Again, not me giving advice. Can't stress that enough. This is not me giving advice. Now, the timelines for the 3 cases are all given here. That was the first case, that's the second case, and that's the third case. And again, these are published in the paper. You can look at them at leisure if you've got a particular interest in this. So, quite amazing. Multi-metastatic stage 4 breast cancer. 3 years, complete remission, apparently gone. Fenbendazol, no side effects, having been basically assigned to hospice care. Quite an amazing story. Quite an amazing story. Just one case, of course. Case 2, I'm not going to go through this in great detail, but case 2, 75-year-old man with prostate cancer, bone scans and CT scans revealed metastasis in the spine, pelvic bones and right humeral head. This is one of the terrible things about prostate cancer. It goes to the bones, causes indescribably painful pathological fractures. He was given conventional treatments and he was given complementary treatments, so we've got quite a few variables here. But the use of fenbendazole coincided with continued regression of metastatic lesions and sustained undetectable PSA levels, which is quite amazing. Prostate-specific antigen, of course, indicating lack of prostatic tumour. After 26 months of sustained regression and no new progression, the patient remains in near complete response and continues fenbendazole with conventional therapy. And the Joseph Tippins protocol there suggests 3 days with fenbendazole and 4 days without. And this is actually very important. There's a lot. You get a lot of benefits sometimes from taking drugs for a period of time and then stopping. So that was case 2, and again, look at the whole details are there. It's the paper is intelligible. It's written in a bit of medicalese sometimes, but it's readable. Case 3, a 63-year-old man, hip growth, so tumour on his hip, melanoma, presumably metastasised from malignant melanoma in the skin. Again, PET scanning showed multiple hypermetabolic foci, in other words, hypermetabolic areas all over the place. Peritoneal and retroperitoneal nodules, so that's in the abdominal cavity, and behind the abdominal cavity, the kidneys, for example, are retroperitoneal. The bit behind the abdominal cavity, but in front of your spine. Focal uptakes in the stomach and small bowel, lesions in the right gluteus medius, various muscles, and L5 vertebrae. So the cancer here had spread to his stomach, small bowel, bones, and muscles. He was given conventional and complementary treatment, but of course they're not normally as curative or as helpful. The patient remains melanoma recurrence free over 11 months. Over 11 months after being declared to be in remission. So declared to be in remission 11 months later. And of course, I would assume the authors are going to follow these patients sort of longer term. 11 months later, still in remission. All these patients have reported no side effects. Conclusion from the authors: fenbendazole demonstrates potential as a novel, promising therapeutic option for repurposing in oncology. Its ability to contribute to tumour regression and achieve disease remission warrants further clinical research to establish its efficacy and optimise its use. Now, I know people are bouncing up and down now saying, but this is just 3 cases, John. Why isn't there a large-scale randomised controlled trial? Well, who knows why there's not a randomised controlled trial, but we did note at the start of this video that this is out of patent. People can't make substantial amounts of money on it. Whereas very substantial amounts of money are made on other new patented cancer treatments. We can say no more than that. Again, I'm not advising taking anything or not taking anything. This is purely for your education and interest. So, okay, it was only 3 cases, but the history of science is replete with, I made a note of a few here, it is replete with people making single observations that then transform the field. I think I'll just look at one because I made a list of them here. I used to teach history of medical science and research when I was teaching research methods. And it was very interesting to learn from these famous cases: Semmelweis and puerperal fever, Edward Jenner and smallpox, Alexander Fleming and penicillin, Joseph Lister and antiseptic surgery. But the case I'm going to give you is James Lind. Now, this is James Lind here. That's him. And James Lind, a Scottish naval surgeon, served on aboard HMS Salisbury famously, and he cured scurvy. Excuse me, cured scurvy in 1747. Quite incredible. So scurvy, terrible disease, lack of vitamin C, of course, tiredness, bleeding, gum disease, skin sores, joint pain. It'll kill you. Killed more sailors at the time than battles. Now, this is actually probably the first clinical trial. He took 12 sailors with scurvy on the ship, on the HMS Salisbury, and he divided them into 6 pairs, which is good. 1 pair were given cider, 1 pair were given sulfuric acid. Don't want to think about that. 1 pair were given vinegar, 1 pair were given seawater, 1 was given a paste of garlic, mustard and other herbs. 1 pair, 2 sailors given oranges and 1 lemon daily. Of course, we know the answer to this already. Now, the results: after just 6 days, the citrus fruit group recovered dramatically. 1 sailor returned to duty, the other was nearly cured, the other showed little or no improvement. So 1 back to work. The other one was well enough to nurse his sick comrades, apparently, according to the accounts. But the others showed no improvement. So he had basically a control group here, didn't he? It was very clever. Lind concluded that citrus fruits were the most effective remedy, which of course they were. Now, he didn't say, oh, only 2 cases. No, this was the nidus of an idea. These 2 patients got dramatically better. The same as these 3 fenbendazole patients got dramatically better. And this was the nidus of an idea. Nidus, it's Latin for nest, and it's where things come from. You take this idea and you need to run with it, not suppress it. So he took this idea and he treated other patients, and of course they all got better. You see, he looked at 2 cases and said, interesting. Let's go further. Why on earth aren't cancer research people all over the world falling over themselves to say, fenbendazole, interesting. Let's put in the $10 million or $20 million to do the full randomized controlled trial. Why aren't they doing that? That's what Lind did. And Dr. Lind discovered the cure for scurvy, which isn't a bad discovery, actually. You know, in terms of, then that, of course, gave rise to the whole field of vitamins. Anyway, that was that amazing story. Wasn't accepted for some time. 40 years, really, before it was fully accepted, wasn't it? So at that rate, we should have active trials on fenbendazole completed by, I don't know, what, 2067? Too late for me, too late for many of you. Curiosity deficit disorder plagues our medical researchers. Established ideas need to be challenged and tested. We have provided in this video, as the authors of the papers have provided, a nidus for further consideration. And it's about risk-benefit analysis, isn't it? If this fenbendazole is not doing harm, then why not try it? You know, people, especially terminally ill patients, should be given the freedom to try these things. There you go. Jordan Peterson, he's off sick at the moment, God bless him. I hope he makes a full recovery. But he said the plural, what did he say? The plural of hypothesis. What did he say? No, that's it. The plural of anecdote is hypothesis. That's what he said. So if you got lots of anecdotes, and you could, if you're being pejorative, say that this is anecdotal. I would say it's more than that, but it's case studies, which is an established method in medicine, of course. But when you get many of these, and we've looked at, I've personally had emails and comments from, I don't want to exaggerate, but I would say well over 100 people who feel they benefited from fenbendazole and mebendazole and other antiparasitic drugs like ivermectin. The plural of anecdote is hypothesis, and the hypothesis is a testable statement. So from this you can generate a testable statement. That testable statement would be fenbendazole, perhaps given 3 days a week in a dose of 220 milligrams, is effective at reversing stage 4 cancer, if it's breast cancer or prostate cancer or potentially melanoma. That's a testable statement. From there, it would be simple to do your randomized double-blind controlled trials. Very straightforward stuff. Let me know why you think it's not being done. So there you go, not medical advice, purely for your interest. And if you're anything like me, it gets you a little bit cross as well. So we'll finish there before more emotion emerges. But for now, thank you for watching. Do read the paper for yourself and only do what your own doctor prescribes. This is not medical advice. God bless and thank you for watching.